Happy New Year, everyone. I hope you all got to listen to the reflections and perspectives on the entire 2014 year in autism science. ASF is looking forward to a very successful and productive 2015. As I mentioned in that year-end summary, if you didn't hear it, please go to the ASF blog linked below. I mentioned that genetics played a huge role in 2014. One important outcome of new genetic analyses is to find new genes or networks of genes and pathways that could be targets for treatments. These include new drugs that treat debilitating symptoms and co-occurring symptoms. Using animal models of autism, 2 new targets were identified in the last couple of weeks. The first is the glutamate receptor, specifically compounds that target what is called the metabotropic glutamate receptor 5, or mGluR5. This is one type of glutamate receptor. You may have heard this term already. A company called Seaside Pharmaceuticals partnered with Roche to study a compound that targeted the mGluR5 receptor in people with Fragile X. People with Fragile X have a lot of behavioral similarities to autism, and this was a good place to start. Unfortunately, the compound didn't do so well in studies in people, and Roche stopped the trial. Novartis also stopped a trial with a similar compound in people with Fragile X. Despite the setbacks, patient groups say that despite the repeated clinical failures, the mGluR5 pathway remains one of the most promising approaches in coming up with an effective treatment. A new study on the mGluR5 pathway was recently published in Nature Neuroscience. It looked at another genetic mutation associated with autism, 16p11. Copy number variations on this area of the chromosome account for anywhere between 0.5% to 1% of autism. Using a mouse model of this mutation, researchers at MIT showed that giving animals a drug that targeted the mGluR5 receptor in the brain reversed some of the cognitive deficits associated with 16p11 mutations. While cognitive deficits may not be a core symptom of autism, this is evidence that this compound may be a target for future studies in other specific genetic mutations associated with autism. In addition to mGluR5, another target was identified, the histaminergic 3 receptor. That's right, histaminergic like histamine, which is the action of Benadryl. But this type of receptor is only found in the brain, and histamine has been shown to regulate neurotransmitters. H3 drugs are used for pain, obesity, and schizophrenia. Researchers in Brazil used the valproic acid model, which is one of the more developed animal models in mice and rats. Treatment with VPA to pregnant animals causes deficits in their offspring that are similar to symptoms seen in humans, including repetitive behavior and impairments in social interaction. They also show changes in cells in the cerebellum reminiscent of people with autism. We know this because of programs like the Autism BrainNet, so that we can actually study brains of people with autism. People who have been exposed to valproic acid during gestation have a high prevalence of birth defects and developmental disorders, including autism. VPA is an anti-epileptic drug, and it's actually quite common to be administered during pregnancy, at least until recently. So it's been accepted as one animal model of autism. Treatment with drugs that blocked activity at H3 receptors improved these behaviors in VPA-treated animals, which was promising. On the other hand, VPA-treated animals are also more sensitive to pain, and the drug did nothing for this. So clearly more needs to be done, like what was done in the mGluR5 study. Look at the drug in animals with a genetic mutation that is associated with autism. It may or may not work, but one of the many reasons the human trials of drugs for autism may have failed is a diversity of autism causes and symptoms. And to examine a drug in one animal model does not mean it will work in all animal models. So you heard a lot of this in 2014, but in 2015 we have more good news on the world of early intervention. A new research report looking at intervention in toddlers showed significant promise. And like last year's study that examined early social interactions in toddlers, it involved parents delivering the interventions at home. In this case, the participants were as young as 13 months of age, recruited from the community. They weren't high risk, so to speak, but those that filled out a short questionnaire and screened positive on a 12-month screener. The problem with this approach is that they are including people who are at risk, not with a diagnosis. So communicating with families about the concept of very early risk markers in the absence of a diagnosis and the importance of intervention earlier rather than later is tricky. Also, since it's really early, determining whether or not this is an appropriate intervention to be covered by insurance can be difficult. Not that it shouldn't be done, but these are the realities in which we live today. The study was led out of the University of North Carolina, which developed this 12-month screener called the First Year Inventory. The kids in the study received an intervention that not only targeted social and communication behaviors, but explicitly intervened on sensory and regulatory behaviors such as attention and adaptability. It's called adaptive response teaching, and it has similar characteristics as pivotal response training. In essence, parents were taught responsive strategies like follow a child's lead, imitate a child, or take one turn and wait. Adaptive response teaching, or ART, employed modeling and coaching to encourage parents to use responsive strategies during daily routines with their children, which were then used to target pivotal behaviors like social play, joint attention, arousal and attention, engagement, adaptability, and coping. These techniques have been shown to improve child development, so it makes sense to study them in autism specifically. The children who received the ART intervention outperformed the control group on several child developmental outcomes in key domains of social communication and sensory regulatory functions. These effects were more apparent in the parent report measures, but also emerged in observed measures like expressive language. These results add to growing evidence that clearly links early behaviors like social play, joint attention, and arousal to later developmental outcomes in children with early signs of autism. Also interesting is the ability of the study to recruit and enroll 1-year-olds at risk of a later diagnosis who were identified via a community-based screening. This itself was quite a feat. It makes sense to do, but what makes sense to do and what's actually possible to do are two different things, and this study did show it was possible. Finally, a small but interesting study on how sex difference in autism and services may affect parental stress. Characteristics of people in the Autism Speaks Autism Treatment Network in LA were analyzed along with parenting stress scores to examine how services received by the children in boys and girls affected parental stress and how parental stress was impacted by the differences that the kids received, if there were any differences. So the results were, first, girls and boys received the same number of services overall, but girls were for the most part receiving less speech therapy and more services in schools. Second, parents of girls rated parental stress scores higher than parents of boys. Lastly, parents of girls reported the highest stress when fewer services were available, but this wasn't present in boys. So in boys, the level of services available did not affect their level of stress, but in girls, the amount of services available did. The highest stress level was found in parents of girls who did not receive treatment in regional care centers. These regional care centers are trained to deliver comprehensive interventions. I know that last point is really hard to figure out. You would assume that level of stress would be different depending on services, but that would be the same in boys and girls. So this is kind of intriguing. This isn't the definitive study on sex differences in services or parental stress. However, it does suggest that there may need to be different approaches for working with females with autism and their families. One significant limitation is the number of girls that were available for study. I know I've harped on this over and over again. The group was large enough to make these statistical conclusions, but more females with autism are needed to draw meaningful conclusions. I hope you all have a great week ahead and look forward to sharing more research news with you next week. Talk to you then.